Okay, and I believe that is it for county department reports. So we will move on to item number 4, which is the COVID-19 staff update. Okay, looks like Dr. Richardson is still getting on, but Marilyn, there he is. Do you want to kick us off, Marilyn?
I will. Thank you, Marilyn Mann, Health and Human Services. Well, we have continued to see a decline in our number of cases. In fact, we've been at 1,417 cases since April 14th, which was Wednesday of last week. We might potentially be adding a case today, but our numbers continue to reflect a decline in the presence of the disease. This week, we're waiting for the designation of whether or not our case metrics this week will be identified as being in the orange or red tier. We're hoping, obviously, we would hope that it's in the orange tier, as that would be the first week of us being in orange. However, some preliminary look at and review of our data based on the state's new metric that's specific to small counties, which incorporates the vaccine rate in our county in comparison to the state. We are concerned that the state, that our vaccine numbers are not reflecting accurately. So we have already preemptively, in advance of knowing where we're going to be assigned today in the tiers, we are already conveying that we want to have the state adjudicate their tier assignment if it in fact says it's in red, because we've had some data discrepancy in our vaccine numbers as it relates to capturing fully the vaccines that are being distributed out of Northern Inyo Hospital. This has been a data issue. Our team has been working diligently with the state for a while to try and get this corrected. That fact, combined with the fact that while Native American community represents close to 13% of our population, which is the denominator, you know, our full population is the denominator used by the state, it still doesn't capture the rate of vaccines that are distributed by Toyabe. So in an effort to ensure that we are advocating to the fullest extent possible to ensure that the data being used is accurate and truly reflects our vaccine rate, Anna has already submitted a placing basically the state on notice that we would initiate an adjudication process if what gets released today at noon indicates that our metrics are still meeting a red tier. So, and Anna can add on to that when she comes on here in a bit to give us some more updates on the vaccines and vaccine clinics that are coming up. We do have vaccine clinics that are coming up. Anna will go over that in more detail, but we are really encouraging people to, if you have not been vaccinated, to please take that step and sign up for a vaccine. The vaccines are a proactive way that we as residents of Inyo County can continue to move towards what we all want, which is a pre-COVID existence where, you know, while we continue to you know, even as we move towards going beyond the blueprint, we will continue to have some state state requirements such as face coverings and other safety measures. But I think ultimately our goal is to at some point be able to live our lives the way we do with the influenza, where we mitigate as much as we can, and we have some layer of protection within our community. So that being said, the other thing that's tied to the reduction in our numbers and our stabilization and our continued decline is that we've also had a decline in our need for our COVID-19 specific emergency sheltering operations that were really designed to meet the needs of those individuals who are quarantined or are isolated and are unable to either stay in their own home or do not have a home. So there was a press release that went out Friday regarding that reduction in COVID-19 specific sheltering, which did, as you heard earlier, include the upcoming closure of the emergency designated safe parking at the Kmart parking lot. However, those individuals who are homeless, whether they are in need of quarantining or isolation, can continue to access the existing continuum of homeless services that are available through our continuum of care, which includes a number of different entities, from AMACA, which is the primary administrative body, Health and Human Services, our local churches, and other entities who provide a wide range of emergency and or low-income housing, a number of different resources. So if people are homeless and in general, or if they're homeless in need of quarantining or isolation, we will still be able to provide that through non-congregate hotel settings. And AMACA has outreach staff available through the continuum of care Monday through Friday from 8 a.m. to 11 p.m. And their number is 760-873-8557 or 873-7709. So I did want to let your board and the public have notification on that. And then, Anna, if you can provide us some overview on the vaccine clinics that are coming up, and of course, Dr. Richardson, any vaccine specific information that you have.
Great. I'll kick off with just a review of where vaccine is currently available. Last week, statewide, eligibility opened up to anyone over the age of 16 to be able to receive vaccine. So we are setting up not only our continuing clinics through our vaccine network, are continuing to receive Moderna vaccine, but we are also setting up a couple of Pfizer clinics because, importantly, individuals that are age 16 or 17 only at this point can get Pfizer vaccine. That's the only vaccine that's approved for individuals under the age of 18. So we are holding a mass vaccination clinic at the Tri-County Fairgrounds this weekend, April 24th and 25th. We have a lot of appointments available. We can run upwards of 1,500 vaccine appointments through Saturday and Sunday. We only have about 360 people signed up right now. So really want to get the word out that this vaccine clinic is open to anyone who works in Inyo County, anyone who lives in Inyo County over the age of 16, and particularly because we don't frequently have Pfizer vaccine available, really want to make sure that those individuals who are age 16 or 17 and their parents are taking advantage of this clinic, as we're not ever certain how much Pfizer vaccine we'll have on hand going forward. We are also planning for a clinic in Lone Pine area with the Pfizer vaccine as well. So we're finalizing some details for that, but expect that to happen next week. And we'll be reaching out via the schools and other and in other methods to be able to get that information out. Both clinics are available on the myturn.ca.gov site. So individuals can go on and register at that site for a vaccine appointment. Pfizer, again, is a 2-dose vaccine. So if individuals sign up to get vaccine through either this clinic in Bishop that's coming up this weekend or the clinic in Lone Pine next weekend, they will be expected to come back 4 weeks later for their second dose. And when they go to the MyTurn site and sign up, it'll give them it'll actually sign them up for both appointments at the same time. So wanted to update your board and let you know that we do have lots of space available at the clinic in Bishop coming up this weekend. Also continuing to have Moderna vaccine available through Northern Inyo Hospital, Southern Inyo Hospital, Valley Health Clinic in Bishop, Vaughn's Pharmacy. Pausing still right now, and Dr. Richardson may have more to say about this, but still pausing on the Janssen distribution while the federal ACIP is reviewing the vaccine safety and providing some guidance around that. So right at this point, Rite Aid is not delivering vaccine. They had Janssen vaccine available. So we are able to, individuals are able to make appointments through MyTurn for the Northern Inyo Hospital Clinic. Also, some of our pharmacies are linked up on MyTurn, like the Vaughn's Clinic. For Valley Health Team, we're asking that individuals call to make an appointment. I'll say that information out loud. That is 760-784-7020. That's the Valley Health Team Clinic in Bishop. And then also Southern Inyo Hospital takes appointments by phone, and the Rural Health Clinic can be reached at 760-876-1146. And lots of appointments available through those providers as well. We are going to be sending some additional information. I know through some of our school districts, we've already submitted, had information sent out around the vaccine clinics, making sure that parents are aware that 16 and 17-year-olds are now eligible and can be signed up. We do want parents on site with minors if they've signed their 16 or 17-year-old up for vaccine. We ask that parents come with to the vaccine appointment. Sorry, pausing because I wanted to go over some of the other outreach that we're doing. We do have some additional campaigns that we're pushing out through social media this week, including a video showing the steps of signing up on the MyTurn system. If anyone's had trouble with that, I know we've had a couple of people that have gotten to a point where a security code's needed, and it's they think it's a confirmation code, so we need to get through a security code that's texted or emailed to an individual. Then you get your confirmation code. So we've got some additional information that we're posting to help people be familiar with that site and signing up. Also should hear some radio spots towards the end of this week, and we'll be potentially getting a signboard up as well with some information. So looking at getting the information out any way we can, and hoping to fill some of those appointments up before the weekend.
Hey Anna, is the same zip code issue in place? In other words, I know anybody can go to either one. To go to the Bishop one, do they have to enter the Bishop zip code?
Yeah, for it to come up, there is, the sites have geofencing applied. So and it has to be a little bit narrow, because if we get too wide out of the Bishop clinics, it starts popping up in Fresno, and we'll get people in Fresno seeing that clinic and signing up and trying to figure out how to get here. So, so if anyone's outside of the 93514 zip code, they can enter either Bishop or the zip code 93514. That'll pop up with those Bishop-based sites to be able to register, and that is still in place at this point.
We need to just make sure that gets out with the messaging. But we know it now, so it's good. We can get it out. And yeah, those people in Fresno, they can just, I mean, we're so close to Fresno, they can just come on over. just like it always shows when you're looking for anything, Fresno.
We might get to that point someday, but I still want to make sure that we're got our Inyo folks.
No, I'm kidding. I'm kidding.
Yeah. Make sure you say you're kidding.
Yes.
And we are, I'm sorry.
Oh, I just had a similar question. So if let's say you're in Independence and you want to sign up for the Lone Pine Clinic the week after, would you use 93545 or 14?
I don't know that we've set up a My Turn clinic in Lone Pine yet. So when we get that set up, we will make sure that it's very clear which zip code to enter. To be extra safe, use the 93545 for Lone Pine specifically. It may actually reach to Independence, so we can use the Independence, but I don't know that for sure yet. But we've got it staged and almost ready to set up. We just need to make sure that we have all of our site confirmed and date and staffing. So that'll be coming out shortly. We'll make sure that we test it and know which zip codes work. But you should be able to search by Lone Pine, California, or by the Lone Pine zip code to get into that clinic.
And I did want to add that the messaging that's going out is going in Spanish and English. We are still trying to make as much effort as possible to outreach to our residents who are primarily Spanish speaking.
I've got a couple of questions, and maybe we should get our tier status and vaccine clinic questions up before we go to Dr. Richardson and Leslie Chapman. So on the promotion, are you guys coming up with some graphics or stuff that we and other citizens can plug into their social media feed to really get the push out to everybody that we can, as supervisors, we can put on our social media and share with other people?
Yes, we do have a couple of posts that we're preparing. I know we have our Instagram post up and ready to go and are working on the Facebook post, so I can make sure that once those are out, that they're shareable and that we have those available for others. I know internally we've been trying to get it shared out through our personal pages as well. So I'll make a note to make sure that you guys have access to those graphics and can post as well.
Okay, great. Appreciate it. On your outreach to the schools, I had a meeting and conversation with Gina Campbell from the community college, and definitely the outreach should be extended to Saragossa as well.
Certainly.
Happy to assist with that in any way.
Great.
And then I did have a question from Dina that probably applies to the schools as well, is after June 15th, when the restrictions are sort of eliminated, we're in the open theater except for certain things. And so will the social distancing in schools still apply after June 15th?
Yeah, that's a good question. And we do anticipate, though the blueprint and the restrictions around that will hopefully at that point, assuming we're meeting all of the metrics that are attached to that, will go away. There will still be guidance around safe practices. And so at this point, we don't have the detail about what I'm imagining large large gatherings and some of the larger events will continue to have guidance associated with them probably into the fall. That's something that's been forecast. For the schools, we don't know specifically what changes will be in place for the schools, and especially going into the fall. Now we will be having to look at summer sessions, and to my knowledge, we don't have any different guidance for the schools at this point, nor do I believe those are tied directly to the blueprint going away. We have specific guidance for schools. So I will certainly keep an eye on that and connect with our school liaison just to be sure that there's no changes that have gone in, that have already been established, or know that if we have anticipate different guidance coming out. But at this point, I've not heard that there are any changes beyond the current guidance that is in effect for the schools.
Okay, great. Thanks for that answer. And they have some decisions to make on planning for as far as what can be in seat and what has to be remote, simply based on the size of the classroom and how many students can be in there with the social distancing and whatnot. So if she has more questions, should I refer her to you or somebody else from the team?
Yes, she certainly could reach out to me, but Marissa Whitney is our nurse in public health who's been working very closely with the schools, and I can connect. I do have Dina Campbell's contact information. I can connect the two of them so they are able to communicate.
Okay, great, wonderful, thank you. And then back to where Marilyn started with the adjudication and the vaccine numbers. I just happened to be getting my teeth cleaned yesterday at Toyabe. And so what they told me there was that, for a while, they've been open to all patients. And as far as the vaccine, and in fact, there's been people, not so much now that it's readily available everywhere, but there's been people who are signing up as patients just to get the vaccine who are non-native people. So I think that number of people who have been vaccinated through that clinic is larger than the 13% native population we have. So if there's any way that I can help with that adjudication process with the contacts that I have, I'm happy to jump on that right away. Because if you look at the Los Angeles Times California County vaccine tracker, it's, I think the number of people fully vaccinated was 30% or 28% or something like that, like way lower than what our numbers show. So I trust your numbers better than I trust Sacramento's numbers. So again, with that adjudication process, if there's any way that I can assist in making that happen, I'm happy to do it.
Thank you. I will be submitting more information to the state by tomorrow, but I think it may be helpful for me to connect with you just to make sure there's not any contextual information that I need to include in that, and also we'll reach out to Toyabe. I don't think that it will necessarily be needed at this time to send the hard data over to the state. The state understands that the IHS data is not feeding in at the local or at the state level right now, but really trying to give the contextual information around, with the number of people served through Toyabe, and those numbers in our overall denominators for the rates of vaccination and not being able to capture those vaccines. That really does make a pretty significant impact to our overall vaccination rate. So, and I think more in Inyo County than probably many other counties because of our demographics. So we'll be providing that context as well as some hard data that we have around some reporting discrepancies that we're working through just on a technical level, where we have at least 600 people we think that aren't being captured in that data already. So thank you for that, and we are going to make a strong argument.
Thanks, appreciate it. Does anybody else have any questions for Marilyn or Anna before we move on to Dr. Richardson? Okay, go ahead, Doc.
Okay, good morning, board. Last week we discussed the Johnson & Johnson vaccine, the pause that was occurring, and it is still in a pause mode. The Advisory Committee on Immunization Practices should have a conclusion on what the recommendations are going to be sometime this week. The likelihood is there's going to be either a warning or some restriction on the use of the vaccine. It's hard to say which. They're looking at the true correlation of the low platelet count in some individuals and clot formation. So the guidelines will probably be changed on the use of the vaccine, and we'll have to wait and see what the committee comes up with. Along the lines of vaccine, Pfizer and Moderna are suspecting or expecting to have a booster dose possibly this summer and most likely early fall to prevent continued disease with especially the variants. So we can expect that for the future. In regards to masking, the question has come up to me about fully vaccinated individuals and wearing masks outdoors. Israel has dropped their mask mandate since 80% of adults have been vaccinated. I don't know if that's going to ever occur in the United States, although we do not have a mask mandate, but we do have an increase in the variants that are circulating. So that would be one good reason why you should continue masking in the future, even though we may have a high vaccination rate. Having said that, I think I would like to encourage anybody that doesn't have a medical reason to get vaccinated over the age of 16 to make sure they get vaccinated at our mass vac clinic this weekend. I think that's an important issue that the public could participate in. So back to you, Jeff.
Okay, thank you. Are there any questions for Dr. Richardson?
Well, just on the Johnson & Johnson, it's your opinion that they'll end the pause and put some restrictions or, sideboards on who and how it can be used as opposed to just continuing it?
Well, I'm sure there's going to be some sort of a warning or restriction, maybe both. That's what's in the news right now in terms of some of the university medical experts are expecting at least some warning. How that's going to be stated, we should know possibly this Friday. They have another meeting coming up, and I suspect that it'll be answered this Friday.
Great. Locally and then worldwide, it's a big issue, and it'll be interesting. I'm hoping that they come up with a way that they can continue to use it, because I know we have some, and it would be good to not continue just to save it. So,
well, yeah, I think it's going to be continually approved. How it's going to be accepted is the big question.
Yeah.
Even though it's extremely rare, which has occurred, less than 1 case per million, 6.8 million doses have been delivered, and only 6 cases are confirmed. There may be a 7th case out there. That's what the committee is studying, whether or not there is additional cases and if there is a correlation with the vaccine. The company Johnson & Johnson is expected to move into the European market for vaccination, so it'll be important for them to have some sort of a release on this pause.
Yeah.
I can't imagine the vaccine will be abandoned, but it may not be as popular as it was. It's hard to know.
Yeah. Yeah, it'll be interesting. Thanks.
It's hard to imagine how less than one case in a million. I mean, you think 1 in a million people could get hit by a car on any
Right.
particular day.
Or win the lotto, yeah. Well, one factor, they're trying to be extremely safe with the vaccine. They don't want to be perceived as, at least the FDA and the CDC, they don't want to be perceived as being lackadaisical about at least looking into the issue, and that's what they're doing. Like I said, the cases are extremely rare. So they may have restrictions on its use in the cases that were identified. They were women under a certain age, within 3 weeks after the vaccine. So they are probably going to come out with some guidelines along that prevalence rate in that group. Although it's low, the public, may have a different idea about it.
Thank you. Leslie Chapman, do you have anything to add for us?
Thank you, Mr. Chair. I don't have anything new today.
Great. And there was one more question that I just remembered for Marilyn. So if with the 3-week wait between changing tiers, so if our data is in the orange and we spend 2 weeks in the orange, can you skip a tier after 3 weeks, or do you still can only go down one at a time?
You go down one at a time. And so we're in red right now. Once we have 2 weeks in orange, then we go into orange, and then our 3-week period for yellow is in play. And we still want, we want to continue moving in that direction regardless of June 15th, because, with each step down, it opens up and lessens the restrictions on our businesses, and which is extremely important, as we all know.
And has the case rate in Mono County continued to stay low?
Did you
I'm
say?
looking right now. I'm so sorry. I haven't.
I'm sorry, you cut out. Well, on my end. Okay.
I asked if Mono County's case has continued to stay low, and I saw Anna immediately turn to her computer. So.
That I don't know, so I'm going to
One moment,
rely on
please.
Anna.
Yes, it looks like Mono saw a pretty dramatic decrease. There's been a little bit of a bump similar to the little bit of a bump we've seen in Inyo County, but they're still remaining fairly low at this point. Not sure where they're going to end up with their tier assignment today, but doesn't look like we have any extremely concerning case rate trends happening to the north of us.
All right, before we move on to the rest of our agenda, are there any other comments from the public or supervisors? Great, thank you so much, everyone. Looking forward to a time when we don't have to do this anymore.
Thank you.
All right.
Okay, thank you. We'll